Imagine waking up this morning and feeling it again. That deep, burning, shooting pain that starts somewhere in your lower back and travels like an electric bolt straight down through your buttock, down the back of your leg, and sometimes all the way into your toes. You lie there for a moment, hoping it will ease, but it doesn't. So you slowly roll to the edge of the bed, grip the nightstand, and you push yourself up. And with every single move, that pain reminds you it is still there, still in charge, still winning. You used to get out of bed without thinking about it. You used to walk to the kitchen and make your coffee and stand at the window watching the morning light without wincing. But now, just getting from the bedroom to the bathroom feels like a mission. And nobody around you seems to understand how exhausting it is, not just physically, but emotionally, to wake up every single day and wonder, is today going to be a bad pain day or a worse pain day? And the hardest part? You do not know if it will ever go away. You have tried the heating pad. You have taken the painkillers that leave you foggy. Maybe you have even sat in a doctor's office and been told that at your age, this is just what happens, that this is just part of getting older, and some part of you is starting to believe it. But I need you to hear this right now. That is not the truth. That has never been the truth. What you are dealing with has a name. It is called sciatica, and according to research published in major medical journals and confirmed by statistics from the National Council on Aging, nearly 1 in 4 people over 60 in America is suffering from this exact condition right now. You are not alone. And here is what nobody has told you yet. 80 to 90% of sciatica cases improve significantly without surgery, without expensive injections, and without complicated procedures. You just need to know what actually works. In the next few minutes, I am going to show you 5 simple movements that together take less than 5 minutes to do, and they directly target the root cause of sciatica pain in people over 60. These are not exercises invented on the internet. They are backed by clinical research from institutions like the Mayo Clinic, Johns Hopkins Medicine, and studies published in the National Institutes of Health database. And they are specifically designed for bodies that are over 60, because your body at this stage responds very differently to pain and healing than a younger body does. Stay with me, because what you are about to hear could genuinely change your mornings. Before we get to the movements, let me take just a moment to explain what is actually happening inside your body, because once you understand this, everything else makes perfect sense. The sciatic nerve is the longest and widest nerve in the entire human body. It starts deep in your lower spine, runs through your pelvis, passes through a small muscle in your buttock called the piriformis, and travels all the way down the back of each leg. When that nerve gets compressed, irritated, or pinched, whether by a herniated disc, a narrowing of the spinal canal called spinal stenosis, or a tight piriformis muscle pressing directly on it, that is when you feel that burning, shooting, electric pain that has been stealing your quality of life. Here is the important part. Research from the National Institutes of Health confirms that in people over 60, the most common cause of sciatica is not a dramatic injury. It is slow, age-related changes in the spine combined with a single muscle that most people have never heard of, the piriformis. And here is what almost no one talks about. Nearly 90% of all sciatica cases originate from nerve compression that is reversible without surgery. Your pain is real, but so is the possibility of relief. Now let's get into the 5 movements, and please do each one slowly, gently, and within your own comfort level. You do not need to push through sharp pain. Mild discomfort is okay. Sharp or shooting pain means slow down. The first movement is called the piriformis stretch, and I want you to pay very close attention to this one because for people over 60, this is often the single most powerful thing you can do to begin relieving sciatica pain. Here is why. The piriformis muscle sits deep inside your buttock, right on top of the sciatic nerve. After 60, this muscle tends to become chronically tight because most of us spend more time sitting than we did when we were younger, and sitting shrinks and tightens this muscle over and over again every single day. When the piriformis gets tight, it literally squeezes the sciatic nerve the same way you might squeeze a garden hose. And just like that hose, the flow gets blocked and pressure builds. That pressure is your pain. A clinical review published in the National Institutes of Health database found that physical therapy targeting the piriformis muscle directly reduces sciatica pain and significantly improves mobility in older adults. Here is how to do this stretch. If you are able to lie down on the floor or on a firm bed, start on your back with both knees bent and your feet flat. Now take your right leg and cross the right ankle over the left knee, creating a figure 4 shape with your legs. You will already feel a gentle pull in the right buttock. If that is enough, stay right there and breathe. If you want more of a stretch, gently use both hands to pull the left knee toward your chest. Hold this position for 20 to 30 seconds, breathing slowly and deeply the whole time. Then slowly release and repeat on the other side. Do this twice on each side. The whole thing takes about 1 minute. If getting to the floor is difficult for you, this stretch can be done seated in a chair. Sit upright, cross your right ankle over your left knee, and gently press down on the right knee while leaning forward slightly from the hips. You will feel the same stretch in that deep buttock muscle. This seated version is just as effective. I want to share something with you. A woman named Margaret, a 67-year-old retired school teacher from Ohio, had been living with shooting sciatica pain down her right leg for nearly 2 years. She had tried several medications and had even considered an epidural injection. She started doing this exact piriformis stretch every morning and every evening. Within 3 weeks, her pain had reduced by more than half. Her words were these: "For the first time in 2 years, I slept through the night." And she said the most healing part was realizing that something so simple, something she could do in her own bedroom, was working better than everything else she had tried. What most doctors never tell you is that this muscle is often the silent cause of pain that gets blamed on everything else. The second movement is the knee-to-chest stretch. This is your lower spine's way of exhaling after a long, stressful day. When we stand, sit, and move throughout the day, our lumbar discs, those soft cushioning pads between each vertebra, absorb enormous amounts of pressure. Over time, especially in people over 60 whose discs have naturally lost some of their water content and flexibility, this pressure builds up and can push outward against the sciatic nerve. The knee-to-chest stretch gently creates space between those vertebrae and allows the pressure to release. Research from Spine Health, which is a trusted resource used by orthopedic physicians across America, shows that the knee-to-chest stretch directly reduces tension along the sacroiliac joint and sciatic nerve root, providing measurable pain relief for seniors. Here is how you do it. Lie on your back on a firm surface with your knees bent. Now gently bring your right knee toward your chest using both hands. Hold it there softly, not forcefully. Hold for 20 to 30 seconds. You should feel a comfortable stretch in your lower back and hip area. Then lower the right leg and repeat with the left. Then bring both knees to your chest at the same time and hold for another 20 to 30 seconds, gently rocking side to side if that feels comfortable. That gentle rocking is like a massage for your lower spine. If you cannot comfortably lie flat, you can do a modified version sitting tall in a chair. Simply lift one knee up toward your chest, holding it with both hands, and feel the gentle opening in the lower back. This entire stretch takes about 1 minute, and it sends a direct signal to your nervous system that the area is safe, which is crucial because chronic pain actually teaches your nervous system to stay on high alert, and this stretch begins to calm that response. The third movement is the cat-cow stretch. Now, I know that name sounds like something from a yoga class, and it might feel a little unfamiliar at first. But bear with me, because this is one of the most scientifically supported movements for relieving lower back and sciatic nerve pain, and it is gentle enough for almost anyone over 60. OrthoIndy, which is one of the country's leading orthopedic medicine organizations, specifically recommends the cat-cow movement to relieve stress and pressure on the lower back and the sciatic nerve. Here is why it works so beautifully. Your lumbar spine is designed to move in two directions. It curves forward and it curves backward. But when we experience chronic pain, we tend to guard our spine and keep it rigid, which actually makes things worse by cutting off blood flow and increasing nerve sensitivity. The cat-cow gently moves the spine through its full natural range of motion, pumping fresh blood and fluid into the discs, creating space between the vertebrae and calming the irritated nerve. Think of it as giving your spine a gentle, loving drink of water after being stuck in one position for too long. To do the cat-cow, you can start on your hands and knees on the floor or on a yoga mat. Your hands should be directly under your shoulders and your knees directly under your hips. First, gently let your belly drop toward the floor. Lift your head and tailbone up slightly. This is the cow position. Take a slow breath in as you do this, then reverse it. Gently arch your back upward toward the ceiling, like a cat stretching after a nap. Let your head drop slightly and breathe out slowly. That is one complete cycle. Do this 8 to 10 times, moving slowly and breathing with every movement. If the floor is not comfortable, you can do a modified version standing at a countertop. Place your hands on the edge and gently arch and round your lower back through the same motion. The standing version is equally effective. Now, before I tell you about the fourth movement, I want to pause for just a moment and check in with you. How has your health been lately? Are you dealing with this pain every day, or does it come and go? Whatever your experience is, I want you to know that I read every single comment on this channel, and your story matters to me personally. Please drop a comment below this video right now and tell me one word that describes how your body feels today. And if this video is already giving you hope or information you have not found anywhere else, please take 2 seconds and tap that like button. It costs you nothing, but it helps this video reach other seniors who are lying in bed right now wondering if anyone understands what they are going through. And if you have not subscribed yet, please do that right now and hit the bell so you never miss another video. This channel exists for one reason only: to help you live stronger, freer, and with more joy in your body. If you would like to support that mission further, the Super Thanks button below means the world to us. Every single contribution helps us create more content like this for seniors everywhere. The fourth movement is called the standing back extension, and this is based on the McKenzie method, a system of movements developed by physiotherapist Robin McKenzie that has been studied and validated in clinical trials around the world. A landmark study published by the McKenzie Institute found that 43% of patients who use this directional movement approach reported significant subjective improvement in back and leg pain, compared to just 15% in the control group. That is nearly 3 times the improvement. And for people over 60 who have disc-related sciatica, this particular movement is what researchers call a centralizing movement, meaning it literally pulls the pain back toward the center of your spine and away from your leg. Here is how to do it. Stand up straight next to a wall or countertop for balance. Place your feet about shoulder width apart. Now place both hands on the small of your back, just above the belt line, with your fingers pointing downward. Gently lean backward, supporting your back with your hands, only as far as feels comfortable. Hold for 2 or 3 seconds at the top of the gentle extension. Then return to standing. Do this 8 to 10 times in a row. Move slowly and never force yourself past your comfortable range. What this does is gently move the vertebrae in a direction that reduces disc pressure on the sciatic nerve. Many people feel a noticeable reduction in leg pain within the very first minute of doing this movement. If you feel the pain moving from your leg back toward your lower back, that is actually a good sign. It means the nerve is beginning to decompress. Robert, a 74-year-old retired postal worker from Michigan, had been dealing with numbness and burning pain in his left leg for 4 months. His doctor had already mentioned the possibility of surgery. Robert started doing this standing back extension every morning and afternoon. After 3 weeks, his leg pain had completely centralized back to just his lower back, and his doctor was genuinely surprised at his progress at the follow-up appointment. Robert told his family that those 10 repetitions twice a day felt like closing a door on the pain. And the beautiful truth is that what worked for Robert can work for you too. The fifth and final movement in this 5-minute routine is something that most people would never think to call a treatment for sciatica. It is deep, slow, diaphragmatic breathing, and the science behind it is remarkable. Research from the Pain Rehabilitation Center at the Mayo Clinic has shown that 10 minutes of diaphragmatic breathing, practiced consistently 3 times a day, measurably reduces chronic pain and its associated symptoms. And a study published in the journal Frontiers in Psychology found that slow, deep breathing modulates the activity of the sympathetic nervous system, the part of your nervous system that amplifies pain signals when you are under stress. Here is the connection that matters for you. When you live with chronic sciatica pain, your nervous system enters a state of constant high alert. It starts to interpret even small, normal movements as dangerous. This is called central sensitization, and it is one of the biggest reasons why sciatica pain feels relentless, even on days when the underlying physical cause is not that severe. Deep breathing directly interrupts this pain amplification cycle by activating the parasympathetic nervous system, sometimes called the rest and digest system, which turns down the volume on pain signals throughout your entire body. Here is how to use it. Sit comfortably in a chair with your feet flat on the floor and your hands resting gently on your belly. Close your eyes if that feels comfortable. Breathe in slowly through your nose for a count of 4, letting your belly rise first and then your chest. Hold for a count of 2 at the top. Then breathe out slowly through your mouth for a count of 6, letting everything release. As you breathe out, intentionally soften every muscle in your lower back, your hips, and your legs. Do this for 1 full minute, about 6 to 8 slow, deep breaths. This is not just relaxation. This is medicine for your nervous system. And when you combine it with the 4 movements above, it creates a complete 5-minute routine that works at every level: the muscle, the disc, the nerve, and the nervous system. Now I want to give you something extra, because you have stayed with me this long and you deserve more than what most videos offer. This is the bonus section, and it covers 3 things that will make everything you just learned work even faster and more powerfully. The first is your sleeping position. If you are currently sleeping flat on your back without any support under your knees, the sciatic nerve is under tension for the entire time you are in bed, which could be 7 or 8 hours every night. Research from the Sleep Foundation confirms that sleeping on your side with a pillow placed between your knees reduces hip rotation, keeps your spine aligned, and significantly reduces pressure on the sciatic nerve while you sleep. If you prefer to sleep on your back, place a folded pillow or a rolled towel under your knees. This simple change can reduce morning stiffness and pain in a way that surprises most people within just a few nights. The second is walking. Not running, not the gym, just walking. A study published in Men's Health and referenced from original research found that people who walked more than 100 minutes a day had a 23% lower risk of developing chronic lower back and sciatica pain. Walking increases circulation to the discs, reduces inflammation, releases natural endorphins that fight pain, and keeps the piriformis muscle from becoming dangerously tight. If you are currently mostly sedentary, start with just 10 minutes of gentle walking in the morning. 10 minutes is enough to begin reversing the cycle. Build slowly from there. The third is nutrition. Two deficiencies in particular are directly linked to sciatica and nerve pain in older adults: vitamin D and magnesium. Research published in the National Institutes of Health database, specifically referenced by Medical News Today, found that vitamin D deficiency is commonly found in patients presenting with neuropathic pain, and that correcting this deficiency significantly improves nerve pain outcomes. Separately, a study published in the journal Magnesium Research found that magnesium supplementation actively promotes sciatic nerve regeneration and reduces inflammatory response. Most seniors over 60 are deficient in both. Talk to your doctor about a simple blood test to check your levels. These are not expensive supplements. They are foundational nutrients that your nerves genuinely need to heal. Now, before I close today's video, I want to say something important. Everything I have shared with you today is for educational purposes only. I am not a doctor, and this video is not medical advice. Every senior's body is unique. If you have a serious medical condition, if you are recovering from recent surgery, or if you are taking medications that affect your spine or nervous system, please speak with your doctor or a qualified physical therapist before starting any new movement routine. Some forms of sciatica do require medical attention, and your doctor is your partner in this process, not your obstacle. I want to close today by saying something that I genuinely mean with my whole heart. Getting older is not for the faint of heart. It takes courage every single morning to face a body that is changing, to push through pain that others cannot see, to keep showing up for yourself and for the people you love, even when it hurts to stand up straight. That courage is real. That strength is real. And you have not come this far in your life to be stopped by a nerve. The 5 minutes you invested in learning this routine today, that is not just time. That is an act of love. Love for your own body. Love for the life you still have in front of you, whether that means dancing at a grandchild's wedding, walking in a garden on a spring morning, or simply sitting at the kitchen table without wincing. That life is still yours. These small, consistent daily movements are the bridge between the pain you feel right now and the freedom you deserve. You are not too old, you are not too far gone, and you are never too broken to begin again. If this video helped you today, please like it right now so that other seniors who are in pain can find it. Subscribe to this channel so you never miss another video that could help you feel better. Share this with someone you love who might be suffering in silence with sciatica or back pain right now. One share could change their life. And in the comments below, tell me which one of these 5 movements you are going to try first. I read every single one, and I am here for you. Thank you so much for spending this time with me today. Take care of yourself, be gentle with your body, and I will see you in the next video.